that, click start, and you'll see your profile information. So profile information, make sure it's accurate and up to date. And then when you get to the next tab here, you're going to see dependents. If you have a spouse or children under the age of 26, please put them in the system here. You won't be able to see the pricing for them if you don't include them in this dependents tab. So let's make sure that you do that. Moving right along, you'll get to the Documents tab here. I'm going to click on this so that you can take any screenshots that you might like of contact information. Here's my contact information. Should you have any questions throughout the year, maybe you want to have some conversation and advice on what type of health insurance plan you should be choosing, whether something through your employer or through a spouse or the private market, I'm happy to give you my advice and chat through options. Oftentimes I'm in meetings like this one throughout the day. So Leah here is your service coordinator. She can answer the phone. She's staffed typically Monday through Friday, 8 a.m. to about 5 p.m. Central Time. So please leverage her if you have any questions and you're not getting a hold of me as quickly as you'd like to. All right, we'll go into benefits next. Here you can see I'm leaving myself as Leah employed and enroll. And as a spouse, I can click yes to having them on the benefits, or I can click waive, and I have to put in a waiver reason. Same thing for children. So I'm waiving due to spouse's coverage for now, just so I can show you the premiums here. So as we already discussed, we're moving to Aloha. The Aloha benefits are going to begin October 1st. So we are going to continue with Loomis through September, moving over October 1st to Aloha. Your MetLife non-medical benefits are going to renew September 1st. We wanted to give you all a little bit more time to make elections and make sure that we were making smart choices with Aloha, which is why we've decided to delay that enrollment by 1 month. Next year, we'll be renewing all of at the same time for September 1st, so that you decide what you want to do now. You do have to keep up your full-time hours worked status in order to be benefit eligible. So contact Laura if you have any questions about that. All right, we are going to look at your benefits here in a closer detail. So as I mentioned, you can see here the benefit options. There are 5 MEC plans with Aloha. The first one here is called WellCare. And on Ease, you saw that there was 0 cost for this plan. This plan for the employee is 100% employer paid. If you want to add dependents to any of these plans, you'll have a cost for dependents. But for the employee, this is 100% employer paid. This plan is your preventative care. So you're going to have access to your colonoscopies, mammograms, physicals, vaccinations, whatever's important to you from a preventative care standpoint is going to be covered 100%. Now, I don't want you to be confused because a lot of these preventative care services, so if you're covering yourself today under the state of California, maybe on one of their plans that are available, or if you have coverage through a spouse's employer elsewhere, you don't need this WellCare MEC plan. This preventative care is already included on all those robust health insurance solutions elsewhere. So I wanted to make that very clear. And then as we go down the line and review these, you're going to see the benefits are going to get richer as we go, and the premiums go slightly higher as well. So a step up from the WellCare MEC here is the Prime Care. Same preventative care covered 100%, but now you get 3 doctor visits for primary care at a $15 copay, as long as you'll use the in-network providers. So really important with any health insurance plan today that you're choosing in-network providers to get your best bang for your buck, but also that you're your own advocate. Because facilities and billing departments and hospitals, we used to rely heavily on them to help us navigate this challenging world, but we really need to be self-advocators and make sure that we're checking our doctor networks and what's covered before we have services whenever possible. So there's my disclaimer to make sure that you're getting the best bang for your buck with your health insurance, whether you're on this Bright Star plan or covered elsewhere. So Prime Care down below here, you'll see all these plans have virtual health visits covered. So there are virtual health visits, there are behavioral health visits. So if you want to leverage those services, you can. And then the copays down here will change. You can see this original MEC plan that's again free to you has discounts only on the prescriptions. This step up in coverage with Prime Care has copays. $15 is the generic copay, all the way up to 75. Now, I do want to make another disclaimer. The Aloha Health pharmacy, putting two words together, pharmacy list is large, but it's likely not going to be as large as some of the more traditional healthcare plans. If you're getting your coverage through Kaiser, Blue Cross, HealthNet, Cigna, some of these large health insurance companies, their pharmacy formularies are always going to be larger. But this is still a great plan for those of us that need healthcare and maybe can't afford some of those more expensive options. So this is a solution with Prime Care. Moving up into these other benefits, you'll see value care. So value care, you still get the preventative care covered 100%. And then with the specialist visits,
I did. I said, well, how do you feel about building spreadsheets and, that way? And you're not muted.
I don't know if you, that's okay, Michael. Perfect. So with value care, again, preventative care is covered 100%. You get those $15 doctor visit copays, maxed at 3 per year. Then you get a network discount for your specialists. Specialists are going to be dermatologists, cardiologists, ENT, those types of folks. Again, you're not getting a copay, but you're getting a network discount. Urgent care, you're getting a $50 copay, 3 per year. And then labs and x-rays are at a network discount as well. Everything below here is going to remain the same. So on all these 4 policies, everything below here is remaining. Shifting over here to Optima Care, then we've got same preventative care. Now the maximums on these general copays goes away. So you have a $15 copay for all primary care general visits, and there's no cap. Specialists, you're still only getting a network discount. Urgent care, same thing. You've got a $50 copay with no cap. But then x-rays, labs are still a network discount. These are remaining the same. Elite care, the big difference is now you get your copays all listed here. So you get a copay even for your specialists at $15, which is a really low copay. Most primary care or specialist copays today are anywhere from $50 to $150 copays. So $15 is a really rich benefit. The labs and the x-rays, again, you've got a $50 copay on those services. Now, it's important to note, just because you're doing an x-ray, most x-rays, they're actually taking images of several bones or several locations of the bones. These x-rays are being covered under a $50 copay, and that's per service. That's just how it was with Apex and Loomis, but I want to make sure that that's very clear. So here's the differences in the plans for these MEC offerings. I want to flip back over to our pricing. So again, that first level, the well care is free. If I want to go up to the prime care visit, it's $5.77 per pay period. Value care, that third plan, $10 per pay period. Optima care is a $14 per pay period. And then the most rich benefit we've talked about so far, Elite, is going to be $21 per pay period. So really good benefits, but these are the 5 MEC offerings that we're looking at. Now, we're going to also be adding in 2 more step ups in coverage for you all. They're called MV plans. So we're going to talk about those next. And by the way, all these summaries of coverage that I'm talking about are going to be added in before you get this ease link. They're currently working on building it. So that's why they're not already showing here as a link of summaries of benefits you can click on. That is what you'll see here shortly. But the Elite Care, again, is our last MEC. Now we're moving down to the Aloha Advantage or the Aloha Premier. Advantage being at right around $96 a pay period for the employee and $144 per pay period for the employee for this richest tier. I'm going to flip back through here. Don't mind my millions of PDFs on my screen. But what I want to show you here is the coverage differences. So again, we've got Advantage, MV, and we've got different buckets of coverage. The MV plans are going to be a step between your MEC plans and your normal robust health care. Again, those plans you're getting on the individual market through the state of California, or you're getting under a spouse's employer. These MV plans are going to be a step between that and the MEC. So there's still going to be some exclusions we're going to talk about, but for most healthy people, these plans provide adequate coverage. If you have a catastrophic illness or injury, or if you're on a high cost drug, you're still going to have risk exposure on these two MV plans. And the reason why your employer is doing this is they want you to still be able to participate in those rich benefit plans elsewhere, like the state of California plans or any income subsidized policies. They don't want to be a disservice to you in that regard. That's why we're looking at these MV plans and MEC plans. So here you can see this plan has a $1,500 deductible. Obviously, double that as a family, and there is a max out of pocket, just like your traditional health care that you're used to. Down here, there's also copays for visits. So there's $15 copays, $50 copays, advanced imaging like your MRIs, CT scans, a $350 copay. I'm not going to dive too much into this just for the sake of time, because a lot of it is very readable and kind of basic to what the MEC plans we were talking about look like. But a couple of areas I want to call out in the differences between the two MV plans is first the deductible. The more rich benefit plan we're going to talk about here has a $0 deductible. And also the other coverage difference, the key one is down here in inpatient facility. So if you are hospitalized, you do need to meet your deductible on this plan, and then a $1,500 copay per admission. But this plan does cover hospitalizations, which is a massive difference between this one and the MEC plan. The pharmacy is also a rich benefit plan here too, which you can see there's a $10 copay for the generic tiers. Higher tiers, there's discounts. But again, if you're on an expensive specialty drug, this plan may not be the best choice for you. Notable plan exclusions. It's written out very clearly here. A lot of these exclusions are the same as what you'll see in traditional robust healthcare, but some of them are unique. So for instance, chemotherapy and radiation. If you have an active cancer diagnosis and you're on this MV plan, those treatments will not be covered. Same thing with dialysis, infertility, like that one's not covered in most traditional plans either, but dialysis, chemotherapy and radiation, some of these prescription drug exclusions, those are the big things you're getting staying on your spouse's coverage or in those other individual policies you might own. So I hope that really helps shed some light on risk in these policies and which plan might be the best. But again, I'm available for personal questions at any time if you want to really vet this out with somebody that has knowledge on all of these.
Holly definitely, Holly definitely is the one with the knowledge. Laura's definitely not. So just FYI.
You do well, Laura, but yes, I should be the one handling those conversations. So you can release all your personal private information to me. I will keep it private. I won't be sharing it with Laura or your employer. Any prescriptions or needs that you have, I'm licensed and bonded for those conversations. So and the network that you'll have in these policies is the PHCS network. It is one of the larger networks in the nation. So good news there, but again, make sure that you're shopping your networks. And Laura has a link for this. Laura, I'll re-forward just so it's at the top of your inbox. But we have a network search link if you're curious. And same thing if you're looking at your RX, your virtual health, those are all listed on this summary. So the big difference, again, now we're going to the premium MV plan. The big difference is now you can see there's $0 deductible, which is huge. It's a very rich benefit that way. Even robust healthcare doesn't have a $0 deductible. A lot of the same copays you're getting down here. And the big difference that I already noted was the inpatient facility care. Now you've got a $500 copay per admission and you don't have a deductible to meet. So that's a huge difference. The exclusions are still similar. You're still going to have exclusions on those expensive medications, dialysis, chemotherapy, everything here on the list. But we're hoping that this might fill a gap for some of you that maybe can't afford traditional healthcare or healthcare through your spouses, but you want more protection than the MEC has to offer. So one other important thing to note is we do need to have enough participation in these policies. If we don't get 5 employees interested in the MV plans, we won't be able to offer them. And if you do enroll in MV and we don't have enough participation, we will reach out and let you know. And if you want to then move over to the MEC offering, you'll be able to do that. So just wanted to put that disclaimer out there. But again, for some of us, paying $95 a pay period for that MV plan could be a good option if we're relatively healthy and hoping to stay relatively healthy in the future. All right. Again, feel free, if there's anything in the chat, Laura, or any questions anybody has, feel free to unmute and shout them out. I want to leave time to talk about some of these other benefits because they're important too. Our dental insurance is staying with MetLife. And again, if I am only enrolling myself, the employer pays 100% of the dental for me, which is a huge benefit. If I click on this summary, you'll see 100% of preventative care is covered. Your cleanings, your x-rays, your examinations, you get 2 of those per year, and there's no charge to you. If you need those additional services, fillings, crowns, root canals, you've got $1,000 per year to put toward those. And that's on a calendar year. So that'll flip over in January. If you go out of network, you still have rich benefits, but they're not quite as good. So I always like to point that out.
So Holly,
And
I think you answered a question I had for myself. The cleanings and all that do not count towards the maximum benefit?
They do not, correct.
Oh, okay.
Mm-hmm.
So 2 per year, and that doesn't go into the 1,000.
You're right. Yeah. And even if your dentist doesn't take dental insurance, because some of them are doing that, or maybe they don't accept MetLife, you still have 80% of those cleanings and exams covered, which is still a good benefit. So really good. Please take a look at this. We want to make sure people are utilizing it. Obviously, your employer is putting a lot of money into paying for these for you. So if I want to enroll my entire family, you can see it's only $21 per pay period to do that, which is still a really good price for dental. I'm not a big believer that everybody needs to buy insurance. So if you're the type of family that has really healthy teeth and maybe you like to go in for a cleaning every other year, you really don't need dental insurance, right? You could pay the cash services through the dentist if that's you. But if you like going in for those routine cleanings, this is a really good value.
We do have a question. So when you say routine, it doesn't account for deep cleanings?
Correct. Yeah. So if you need, they call it perio. If you need perio cleanings, that's going to be covered typically under major services. So you will still have some coverage toward that, but it won't be as robust as the routine cleanings covered 100%. And if you do need perio deep cleanings, I would recommend having them give you an estimate up front. They should be able to provide that to you before you get the services done. Good questions. I've had to do them and they're not fun. So I'm sorry for whoever has to go through that. All right. We'll go on to vision insurance. Vision insurance is provided through MetLife as well. And if I enroll just myself as an employee, you'll see it's again free. Your employer covers 100% of the dental, the vision, and also the life insurance. So it's a really great benefit. We need you to log in and make your elections so you at least get to participate in those free benefits. That being said, if I put my whole family on the vision plan, again, it's a really good value. It's only $3.40 per pay period for you. But not everybody needs vision. If you click on the summary here, you'll see the coverages. There's an eye exam covered at a $10 copay. If your health insurance plan doesn't cover that, this can be a nice cost savings for you. There's money towards frames. There's money toward lenses. There's money toward contacts. So all really good coverage. And MetLife uses VSP with their vision provider behind the scenes. So MetLife is not going to issue ID cards to you. You can create an account at metlife.com if you want to access your ID information. So keep that in the back of your mind. All right. Moving right along, basic life insurance covered, it shows 25,000. This is the basic life insurance amount, regardless of how you pass away. If you're under the age of 65, that 25,000 goes to your beneficiaries. You have an accidental death policy as well, which is 25,000. So if you passed in a car accident, 50,000 would be going toward your beneficiaries. So again, your employer pays 100% of this for you. They don't want to watch your family members struggle if something happens. And this is free. All the information on reductions once you get over the age of 65, everything's in this plan summary. Voluntary life insurance, if you want more coverage than the employer provides, you can purchase additional life insurance. It is a really good value, and I will tell you it's very easy. So if you've had medical history that keeps you from qualifying for life insurance outside of your employer, or you've maybe just been meaning to get it for a long time and you haven't wanted to go through the medical blood tests and the things that they might require. Again, this is an easy way to get coverage and it's affordable. Now, if you're an existing employee of the company, these benefits you were already offered. So if you want to participate in them now and you declined them last year, MetLife will likely require a healthcare form to be filled out, marking yes or no to various medical conditions. They call it an EOI. So you can see here the system is smart enough to know, and it tells you your enrollment is pending. If you're a new hire, you get access to these plans one time at guaranteed issue, where you can enroll in the life insurance as an employee up to 100,000 in death benefit, and there's no medical questions asked. So a really good value. One thing I like to note here, you can get coverage for a spouse, children. You can pick your sliding scales here. If you picked 10,000 for your children, it's going to cover all children under the age of 26 in your custody, and it covers each of them for 10,000. You don't have to buy them all policies. So I think this is something that's smart. Obviously, I'm a mother of 3. I would never imagine something would happen, but if something does, it's typically a pretty big financial burden. So I think this is a very inexpensive way to do that. So as you can see, my 10,000 for me, 5,000 for spouse, 10,000 for children, it's a whopping 67 cents a pay period in this example. Okay, short-term disability. Short-term disability, this is not your cost. I want to be very clear. I wish they printed this better, but this is your benefit amount. The system has your payroll figures input. So based on 60% of my earnings, it's saying I would receive $577 per week in benefit if I were too sick or too hurt to work. Now, the great state of California has an employer disability program through the state. So you would get the bulk of your benefits through the state first. MetLife comes in and pays you any remaining to bring you whole to that percentage that they're guaranteeing here. And you can see that because they're only charging 56 cents per pay period. They know they're not covering this full $577. The state is going to pay the bulk of it. You're going to get what's remaining. I want to be very clear because for some of you, it might not make sense to pay the 56 cents per pay period, and that's okay. Maybe you're happy with the state pool and that's enough for you. Next, after short-term disability, so the first 90 days is when that short-term disability plan kicks in, then you're going to have the long-term disability plan. You, in this case, I would receive $2,500 under long-term disability, and this is a monthly figure. So monthly, I would receive that, and it would last until full Social Security retirement age for most disabilities.
Holly,
yeah.
Are these amounts pre-tax or post-tax?
Good question. We would have to look at how you have them
These
set
are
up for
Carmen
payroll
questions.
purposes,
They're not my questions. They're Carmen's.
Oh, I love Carmen's questions. She's always my question asker every year, and it's helpful. Then I feel like I'm not talking at the screen. Yes, we can verify, Laura, maybe something to verify with your payroll provider. If the premiums are being taken out post-tax for the employees, the benefit is tax-free. If the premiums are taken out pre-tax, the benefit will be taxable. So maybe something you could follow up with for her. But the long-term disability, there's a 2-year cap on mental nervous disorders and drug and alcohol dependency. So all of the insurance companies do this. They're only going to pay out a maximum of 2 years for those disorders under long-term disability. And that's because they're some of the highest in claims that they see. So I am a big believer in long-term disability for everyone, unless you have enough money in your savings to retire, which most of us don't. Long-term disability, we can never foresee getting too sick or too hurt to work. And I will tell you, if it happens for many months or many years, it's very destructive financially. This is by far the least expensive way for you to get this coverage is through your employer. And that's why they offer it to you, is because they know it's a good value. It's $3.04 per pay period for me in this example. So highly recommend looking at this if you've declined it in the past. Legal benefits. So the legal plan is the same cost, whether you put yourself or your family on it. There's a whole list of things that you can utilize this for. This is the pre-registration. Wrong click. There we go. Money matters, home and real estate, estate planning, traffic tickets, wills and preparations on that side. So I highly recommend looking at this if any of this is of interest for you to get completed in a more inexpensive way. They utilize law firms across the country, and they just bundle it under this service to make it more affordable. So $4.50 per pay period for that plan. Beneficiaries is the next category. Again, please review this. Make sure that you're not missing any beneficiary information that should be in here. If you pass away, we want to know who these dollars should go to. Don't let it go to the government and probate. They're going to take up to 9%, and your family members are going to be struggling through that process. It's very quick when we have a beneficiary form on file that we can get a check cut versus probate. And then summary, it's going to walk you through the summary of everything you've selected. You can make any changes that you desire. It's going to show you all the costs. But one thing that people sometimes stop at is the summary. You do have to continue. You need to go in here and sign your forms, and you need to get to finish. Otherwise, the enrollments will not get put over to the carrier, and it makes more work for poor Laura. So please make sure that you get this completed. For whatever reason, there's a lot of forms, and it's really slow on my side today. I don't know if it'll pop up, but oh, yeah, there we go. As soon as I say it, it does. I should just stop saying that. So it has you type, scan. Obviously, you can read these documents. I'm just going to click sign here for the sake of this example. These are all the forms that we'll be sending to the carriers. And there's a lot of them. These insurance companies love to burn trees. Okay, finish signing, top right. Make sure you hit finish signing. Make sure you see 100% complete here in the top right to know that you've completed this on your own. So open enrollment, again, is going to start shortly here. Hopefully we've got those emails out to you tomorrow, if not early next week at the very latest. We're just waiting on those medical summaries from the carrier from Aloha so we can get those plugged in. But